Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have the next men, which is called as meant to be. The next type of men is meant to be. This meant to be mainly contains the medullary carcinoma of thyroid. It contains pheochromocytoma, intestinal ganglioneuromas. Then we have mucosal neuromas, megacolon, and marfanite features are important in MEN2. In MEN2, we have medullary carcinoma of thyroid, pheochromocytoma, intestinal ganglioneuromas, mucosal neuromas, megacolons, and marfanoid features are seen. So in MEN2B, here the main defect in MEN2B is in the ret oncogene. Here the defect is mainly in the ret oncogene, which is actually a tyrosine kinase domain. Here the chromosome defect is chromosome 10. So here the defect is in ret oncogene, which is present on tyrosine kinase, which is a tyrosine kinase domain, and this ret oncogene is present on chromosome 10, and it is an autosomal dominant condition.
thank you and thank you for watching.